More than 50 million people in the U.S. have osteoporosis or low bone density. At worst, your bones become so brittle, minor falls, bumps, even a sneeze can cause a serious bone breakage. To learn more, we turn to UofL Health's Dr. Andrew Duffy. So, doctor, let's start with osteoporosis. What are some of the signs and symptoms you'll see?
Honestly, there's not a lot of signs and symptoms. The one thing that you can notice, some people will lose some height. So elderly patients, when they start to have fractures in their vertebra, they'll lose height. But honestly, most of the time, the sign is when you fall and break something from minimal trauma. So falling from height and breaking a wrist or breaking a hip, that's the real sign that you have a major problem. So.
And what people are we talking about here as far as who's most at risk?
Yeah, so there's lots of risk factors. Elderly patients are obviously one, less active patients, people that are sedentary, even people with low bone or low body mass, that's another risk factor. People with chronic disease like kidney failure, and one of the biggest categories is postmenopausal women.
Oh.
So white females over the age of 50, a big category of risk factors for osteoporosis.
Okay. And so when we think about treatment and some of those preventative steps that people can take right now, what is your advice?
So obviously, calcium and vitamin D supplementation can help with your skeleton. You always want to talk to your doctor before starting any medications. There are medications out there that can be prescribed for people with osteoporosis. A category of drugs is called bisphosphonates is one. But weight-bearing exercise, just exercise in general, can be helpful for your skeleton. Your skeleton's dynamic. It responds to stress by getting stronger. So exercise is one of the best things we can do to help prevent osteoporosis.
And when people come into your office once they've broke a bone, is it too late? Can you still take steps then?
No, steps can still be taken, but the cat is out of the bag. You're already kind of crossed that threshold. But I think it's never too late to start doing the things to help prevent it from happening again.
Excellent. Well, we really appreciate you taking the time today to come and see us. We know you're very busy, but this is really good information to have.
Well, thanks for having me.
Absolutely.